Good morning, Angela.
Good morning. Happy Monday. Happy spring.
First day of spring. Does not feeling that much like spring,
I think
but
we're bringing in at about 21 degrees.
the sun's shining though.
And the sun is shining.
I will take the sun any day.
Speaking of the sun, I am so glad you brought the sun up because today we're going to be talking about infrared therapy.
Yes.
And honestly, all the good parts of sun exposure, right, without the UV rays that are harmful, our infrared therapy actually can simulate sunlight with all its healing benefits without any of the hazards. So I think this is a good time to start
great.
to talk
I love
about
this. I have not heard that. Explain in that.
Like how it
before.
simulates sunlight,
light.
how healing light. Yeah. So sunlight, at its best, first of all, it is what gives us those normal levels of vitamin D, right? If we were to use it actually correctly. So they say about 15 minutes of light exposure. The problem is that now we're combating, again, all the harmful UV rays, and which is why people are putting sunscreen on and things like that to protect the skin. But at dosages of vitamin D3 levels actually, and actually, did you know that if you did expose your skin to the sun, that you would need to go 24 hours without washing your skin off to get the full benefit of actually, absorbing that. Yes, is it? Yes. So there's so much fun to talk about. But infrared therapy, outside of the healing benefit that it gives us feelings of well-being, taking inflammation out of the body, but actually causing what we love to talk about is lymphatic drainage. And I think that's important right now because I think people with the spring coming up, when it decides to show up,
and I think another important factor that I'd love to get your take on as far as it goes with red light, but I've been seeing more consistently people talking about because of the time change recently is their circadian rhythms.
Yes.
Right? Mm-hmm. And so, again, how much just 10, 15, 20 minutes, depending on how bright the sun is, being outside, getting that exposure can completely reset the circadian rhythm and the circadian clock. I'd love to, maybe not today, maybe that's an entirely different podcast, but talking about circadian rhythm and red light I think would be great because it's become extremely apparent over the last week. Once we hit that time change, everyone's like, what just happened to me?
Right. And for those of us who may not know what circadian rhythm means, it is your body's sleep rhythm. It's your body's own clock and the way that it adjusts and what it goes through as far as, the whole entire cycle from wake to sleep.
Yeah. So I would love to. It would be fun to go down that rabbit hole, but let's.
Okay.
I'm sorry, I've got off topic. Sunlight. Benefits D3.
Yep.
Spring break is coming up.
Yes.
Summer's
coming up.
Yeah, and so we always try to ride this line of when we're talking about red light, which is kind of our focus for today's podcast. There's really two different, not mutually exclusive benefits that people are getting. There's a physiological benefit where we're talking about vitamin D and just mood enhancement and immune and pain. And then there's the aesthetic side of things. And so, anyone who's coming in is going to reap both benefits.
That's right.
And so we don't want to just talk about, hey, spring break and summertime wedding season is coming up.
Right.
That is a factor. And people, that is important to want to look good and feel good and lose weight in inches and become more metabolically healthy.
Yes.
But there's another side of the coin where it's not all about that, and there's some other additional health benefits that you're going to get from red light that are just as important.
That's right. What's beautiful about red light and why honestly I fell in love with infrared therapy is because it is an inside job. And when we start talking about And I even struggle to use the term weight loss because literally, when I sit with people, I'm like, do you realize what we're about to do is totally liberate toxic material from your system, which is going to give you this benefit of, like I said, it's an inside job. Weight loss should never be approached from the outside in. As far as, right, it is from the inside out. You got to take care of what's going on in here, mind, body, spirit, and then your body actually follows suit. I always tell people, you put good things in, guess what? Good things are going to come out.
That's great. There's a lot of levels to that.
So much.
There's
much.
a lot of levels to it. Okay, so you mentioned people coming in for this. Walk me through what, that first session, because we're having a lot of people come in for consults.
Yes.
What's the goal of the consult?
Really getting into and digging into quality of life. I love talking to people about, so the very first thing we do is let me get to know you for you and not just for your paperwork right now. Like, let's actually sit together and let's talk about what is most important to you here. How can I support you here? So we go over, we take 30 minutes to do, talk about their past, to talk about their, history, to talk about present, what they've experienced in their body up until this time. And then with that information, figure out how does that translate, and a lot of people, how does that translate to pain? How does that translate? And you said last week, how does that translate to your dis-ease, right?
Well, and I think people, so it brings up a really interesting point about how, first of all, people don't take the paperwork seriously. Right? Because
you'll see no response.
Any other office, any other doctor that they've been to, it's all about the what, right?
The symptom,
the procedure, the medication, it's not about a why.
That's right.
And so oftentimes once we start talking to people, very common statement that we hear is, wow, you guys it's the first time that I've ever, this has been different than any other doctor's office consultation provider that I've been to, because you're actually trying to figure out what's going on. You're actually listening to what's going on.
Yeah.
And so that would actually be interesting to dig into a little bit deeper as far as, even before people get our paperwork, letting them know this is actually important because we want to have these conversations. It is not just come in so we can tell you what to do.
That's right. That's right. Really understanding where it all began is going to be one of the biggest superpowers, like really, really talking about where did this originate, and let's go to the very center of that. Let's stare down whatever darkness it may be and then love it back into the light, because this is what is beautiful about holistic healing, right? Living fully expressed, really understanding somebody fully, not just these compartmentalized, my body is somehow separate from my mind or somehow separate from the things that I've been through up until now. It's not, it's all interconnected, which is why, like I said, it literally is liberation. It really is liberation.
It's not just toxin liberation. It's liberation on another level.
On a whole nother level. Yeah.
So consultations, super important. Understanding really why somebody wants to do red light therapy, because there's a lot of, we've gone through tons of benefits and reasons why people should do it. But to really commit to doing it is gonna, you have to have a good why behind that.
That's right.
And then so you kind of work through that with somebody and make sure everyone's on the same page. And then what?
And then what's really fun is we actually get to see how someone responds to the light, right? Everybody's going to respond completely differently because they're all biochemical, unique individuals. So not any two people are going to respond the same.
Sure.
As a matter of fact, the way that infrared works, I don't know if you want me to go over that,
Sure.
but our Dahlia unit actually has 3 low level laser wavelengths. Our wavelengths actually range from 635 nanometers all the way up to 925 nanometers. We use different frequencies and different concentrations of those frequencies to achieve different results. So your pain management nanometers are going to look really different from your lymphatic drainage nanometers. Wavelengths going to look completely different.
So we can control that before someone starts a session. We can
That's
say, okay, unit, we want to focus on circulation. We want to focus on pain. We want to focus on weight loss.
Yes, and
skin
then
tightening.
skin enhancement of all sorts of kinds, acne treatment, things like that.
And then it adjusts the wavelengths.
It does
accordingly, based on evidence.
That's right.
Science to get the best. We know gets the best. The best wavelengths to get the best results for those outcomes.
That's right, and I think this is important because I have a lot of people actually coming in saying, "Oh, well, I just purchased this off of Amazon," and I think that's great. You will get, maybe there will be some benefit derived, but as far as the concentration and the equipment being completely medical grade and completely safe, because there's technology in that equipment that's going to adjust to your body temperature. So if it starts to even go over that nanometer that we have set in place, the system's actually going to lower everything down to make sure it's adjusting. So number one, making sure you're getting the right kind of infrared wavelength lights and making sure that, what you're experiencing is safe.
Yeah, and we can tell you based on, the cost of the unit, you do get what you pay for, and there's no way people are getting something off of Amazon that is as powerful.
Correct.
Or like you said, has the smart technology to adjust and be safe,
right?
While people are using it. So people come in, we're going to look at how they respond.
Right.
We do that by taking pre-measurements, but one of the most common questions that I know the girls get, because I hear them talking about it up front a lot, is, what do I wear when I get red lights?
Oh my gosh. Okay, this is so important. So you want to make sure that the area that you are being treated in is completely exposed to the light. So we tell people whatever that they are comfortable with. They can come in here with a 2-piece swimsuit. They can do bra and underwear. Sometimes there's no clothing because of the area that needs to be treated. So just being mindful of that. Also being mindful of, you don't want any interference. You don't want anything standing in the way of you and that light. So no lotions, no oils. If you're having your face treated and neck treated, make sure that there's no makeup on. So those are really important. Yeah.
That's great. And so before they change, we're doing pre-measurements.
That's right.
And we're measuring how many different areas?
So actually we measure 2 arm measurements, each bicep, each inner thigh. We actually get 3 different measurements around the waist. So you got right around your midsection where your belly button lies, and then 2 inches above it and 2 inches below that.
And we can also target, if somebody has a really specific, hey, I want to focus on this area.
Exactly. I have men and women coming in and saying, I'm actually here to focus on my chest.
Mm-hmm.
So, or I'm here to focus on, like all around, like, so sometimes like just at the back
side,
upper back. So just depending on where they are wanting treated.
And we can do multiple areas of the legs.
We have 6 body pads and a face plate. So, you can treat the same area over and over again, or you can actually start to rotate depending on how you're experiencing movement. So you were asking about, yes, we do take take before measurements, I let people know the way that it works is this. Like, why are we taking measurements? They ask me, and why in the world, how in the world could this even happen so fast, right? What people ask me all the time, so what, you're going to see measurements? Like, what, you're going to see a change today? And I always tell people, actually, that is what I am hopeful for, is to see a change in one direction or another. I tell people, please do not panic if you actually gain inches today. So I want to go through that and why that's so important. So the way the technology works is that once that light emits your skin, it penetrates about 10 millimeters deep. And what starts to happen is it starts to heat up and liquefy the contents in your fat cells, right? As a result of that liquefaction, what starts to happen is your cells actually start to expand. It's called transpository diffusion. So your cells start to expand and they become porous. And as a result of those pores, or now the little perforations in the cell themselves, this is where we get to actually start to excrete the toxic material and the triglycerides in the cell itself. And then the cell eventually starts to expel those toxins and shrink down to the size of a raisin, leaving the shell behind, which is also very important. I want to talk about why that's so important too. So it is a 72-hour process. So some people come in and they start to expand, right? And so they're, where I took that measurement around that midsection, now they're seeing a couple of inches additional, and I say great. That's awesome, because we're actually responding, right? Or some people are a little bit quicker, right? They'll actually, that process of it happens really quick, and they're actually starting to drain those cells, which is awesome. So you can see measurements start to decrease in that amount of time, just depending on who you are. The one I watched for is people who actually don't make any movement at all, right? Then we have to understand, okay, there's something deeper going on. If you're not responding in one direction or another, we really need to focus on maybe talking about liver detoxification, right?
Body's holding on to toxins.
Your body's holding on, exactly. We don't want that recirculating in the system. So if we're holding on to toxins and we're not able to lymphatically drain, you have to remember that the whole lymph system, once you start to drain into interstitial spaces, you excrete through urine, sweat, and bowel movements, but you have to remember the lymph system shunts itself into the liver, and then the liver packages it all up very nicely and neatly and sends it into the toilet. But if your liver is caught up, and people always say, oh, my liver's caught up, and the first thing I know they think of, they're like, it's not just food toxins and environmental toxins, right? Or alcohol or caffeine. You have to remember that your body's also responsible for, your liver's responsible for metabolizing hormones.
Hormones, yeah.
So, yeah, sometimes it's like hormone balancing and liver flushing all at the same time. So, yeah. So what we do is, if you don't move, we have a deeper conversation and say, hey, listen, I really think we could stand to do some hormone balancing here, and definitely some liver cleansing.
Yeah. So they do 20 minutes, we do pre-measurements, 20 minutes on the red lights, 6 pads of face shield we can put wherever they want to target. And then afterwards, they're doing the vibration plate. So we talked a lot about lymphatic drainage. What's the Vibe plate doing that we're trying to accomplish with that?
Because my mind always works in pictures, I tell people it's like, when your kids were little and you stopped using the sippy cups and you stopped putting the lids on, but now they're running with an open glass of water or an open cup of water, and it's like, it's everywhere, and so that's pretty much what your cells are doing. They're really just, it's like running, literally. So that vibration is actually helping with, we want to kind of gain some momentum and giving it a head start in actually some of the, releasing some of that garbage. Okay. Yeah.
And it's also helping the body move.
Oh my gosh.
Circulatory wise and lymphatic wise, we're trying to get it to the liver faster so that it can get cleared and out of the system.
That's right.
Faster, right?
That's right.
And then, so 20 minutes red lights, 10 minutes vibration plate. and then we do post measurements, right?
That's right.
And so so we talked about sometimes people gain, sometimes people lose, sometimes people don't change.
Right.
That's not completely even across the responses, right? Maybe it is. Like, what's an average response to?
So if you're gonna like ask me like
do
average,
yeah, well, like
net.
do 70% of people lose inches, 10% don't change? Like, what's that breakdown to?
Yeah.
And maybe you don't know that, but
right. I would say
you've seen a lot of people over the last year and a half.
I have, and I would say that you're right. As far as what percentage of people don't respond, it's a very small percentage. I can tell you that.
That don't change at all.
That don't
either
change
up
at
or
all,
down.
or up or down. So it's a small percentage of people. And then I would say that it's probably a mixed bag, split down the middle of people who actually diffuse. What's going to happen is I've also seen it this way. I've also seen people diffuse in some areas or expand in some areas and start to lose in some areas, so they're all over the place, which is kind of fun. And then what's really kind of fun is like, so I'll sit with them and I'll say, hey, before you leave, let me take that extra measurement, the one where you're expanding, because I want to see what your body's doing. And it's funny, by the end of our time together, I'll take that last measurement and I'll be like, there's already change happening, which is pretty exciting.
Got it.
Yeah, people ask me, so remember it's a 72-hour process, right? So you're going to continue to drain for 72 hours. So taking care of your body in that 72-hour time span is huge, right? Making sure that they're drinking upwards to 100 ounces of water a day to help them with that flushing is huge. People ask me about compression garments, and I say absolutely yes. If you can stand to wear them over that 72-hour period, it's going to benefit you greatly, because it's also going to do that thing where it's actually starting to help you drain a little bit more. So if you can stand to sleep in compression garments, that's great.
Wow.
Yeah.
That's also, we've done a shorter video on why we recommend red light twice a week, and it's because you've got that 72-hour time between, and so you can maximize a week's worth of red light benefits if you're doing that, every 72 hours, which is about twice a week on average.
That's
You're
right.
going to, see continued benefits through the length of the week.
That's right.
Especially if you're making additional dietary changes, which we also talk to people about through all of this. But interesting. And so we're still in March right now. Through this month, we are doing a special. So let me back up. You do post measurements, you relate that to someone's goals, and then we're making recommendations.
That's right. Like how many treatments. So if somebody really did come in with a goal and they were like, listen, this is where I was pre-COVID and this is where I am now, and it's time. And so I'll let you know how many sessions translates into that 20-30, pound mark. Some people come in with even bigger goals, so how many rounds, how many times, how many infrared sessions actually are going to translate not to just then inch loss and toning and tightening, but then how does it translate to weight loss? So we'll make those recommendations.
And that was a big factor in us looking at red light. Was we were at one point we have an amazing system with Chirithin on weight loss and seeing that significant change with people, but a common response was, now I've got the skin and not happy with how that looks.
Yes.
And what's amazing with the red light is we're seeing inch reduction while they're losing weight.
Yes.
And a tightening of the skin. And so,
and that is amazing, because that's even with people losing upwards to 70, 80, 90 and over 100 pounds.
Yeah, we've had people who have lost 100 pounds.
Yes, we have.
Outside of the office.
Right.
They come in and they do red light just to help
with the skin tightening
around the arms and waist. And
what I have loved is just even seeing people who have been in the office who have lost the 100 pounds and no skin sagging. That's what's also crazy. It's mind blowing.
And so we create, based on recommendations, we typically recommend series of either 8 or 16, and then we can cycle through that again. Who would be somebody who would really want to do 8 versus 16?
Okay, so if you have, let's say, 5 to 15 pounds that you want to lose, or you want to liberate before we get into swimsuit season, right? Or before we get into tank top season or shorts, or, just, feeling good about you and your own skin, right? So 8 sessions, this would be great. This is why we're doing this special. So 8 infrared light sessions. We're also going to make sure that you are eating in support of your liver through that time. So we're going to make some dietary recommendations with that 9-day Chirothyn. So we're doing that right now. So yeah.
Yeah, so the special that we're running through March right now is 8 red light sessions.
That's right.
And we're including a 9-day Chirothyn in that.
That's right.
And we're doing that for $11.97.
That's right. And you have up until the very last day in March
to purchase that. You don't have to complete all of your sessions by the end of March.
Right.
So if you have a wedding coming up in April, May, June, July, you can use those to get ready for wedding season or vacation later in the summer, or whatever you want to use those for. And then also, it's phenomenal for people who want to try red light.
That's right.
Right? Like, I've been thinking about this for a while.
Yes.
This has been on my radar. I don't think I'm ready to commit to a larger program, 16 sessions and
right.
8 to 10 weeks worth of commitment. But I can do, 9 days of Chirothyn.
That's right.
I can do 8 sessions of red light,
Right.
And then really see what the results and changes are like. So, what are we missing here to wrap things up?
I know. It's like that one thing in the back of your mind. You're like, what haven't we talked about?
I think that's good. I think post then, as someone comes to the end of their 8 sessions and 16 sessions,
that's what we want to talk about.
Then we're talking about maintenance, because our biggest concern everyone has is
right.
How do I keep these results, right?
That's right.
I've yo-yoed, I've gained, I've lost, I've gained, I've lost. How do we keep these results?
We don't want lifetime members here, right? We love you and we hate to see you leave, but we love it when you are,
successful,
client free.
Yeah.
Exactly. So making sure maintenance, right? So I always encourage people, this is my mentality. This is not a stop-start process as far as what you learn as far as nutrition to actually support your body. Like, that's not a beginning and an end, right? It's a springboard to a lifestyle change. It's a journey. It's a process, right? It's one thing to be outcome oriented and another thing to be process oriented, right?
We want you to see results quickly.
Right. So you're motivated and you will, but we want you to take really good care of yourself during that time, which is what we'll talk about too, because remember I said that the cells shrink down to the size of a raisin. There's a couple of reasons that's really important. We're not causing damage to the tissue. And that's because a lot of people talk about like, oh, well, if I come in and I get these areas treated, will I be lumpy here? Or will I, will it look uneven here? And we say absolutely not. That's not going to happen. We're going to actually rehabilitate connective tissue. But the reason that cell is intact is because, right, we didn't destroy it. So it's if you jump off of the healthy eating bandwagon and you're eating pizza and fries and burgers and all sorts of things like that, then that cell is going to recollect that toxic material, right, and
get larger
again.
You're gonna you can revert back to
that's right, and we don't want you to, which is why we are very method eating oriented too. Yeah. We're going to give you the tools to stay successful
and the support and coaching
that's
through
right.
this process.
That's right.
Which is, I think, the key to why we've had so much success with it is